Well, when I selected a family practice residency some 30 years ago, I knew that I wanted to acquire some unique and special skills that family doctors needed to provide comprehensive and continuing care to the patients that I'm going to be taking care of. It's the opportunity to apply these skills in the setting of a trusting, long-term relationship with my patients and their families. That opportunity was really what gave me the impetus to select family medicine as a career. So our population is aging. As we age, we get lots of chronic conditions like diabetes, heart disease, chronic lung disease, and arthritis. We know that over the next 15 years, it's been projected that the number of people that have at least one chronic condition is going to go up by about 60%. So that's been reflected in the changing nature of my practice demographics. In fact, I have a lot of patients who have more than one chronic disease, and often they have also mental illness. So it's become much more difficult to manage them. It takes a lot of time when they come to my office, and they need a lot of resources. We need to refer them to a lot of places to get care. And unfortunately, that takes time. There's often these resources not immediately available, and they have to wait. So with my patients often on the waiting list for medical services, while some are discharged from hospital quite early, and others are not being admitted to hospital until they get very sick, it's become much more challenging to look after them while they're in the community. So I've had to make some changes in the way I practice, in the way I organize my practice, and I've had to learn some new skills. And one of the changes I've had to make is to put in an electronic medical record so that I can better manage my patients as well. It's also become more important to work collaboratively with other health providers and make use of course, other health services that are available in the community. Often though, just being able to communicate with these health providers and health service units has been a challenge. Oftentimes we can't get through. When patients come in, test results are not available. Oftentimes we make referrals to specialists, we don't hear back from them. So managing the flow of information has become a real challenge, and that's even with the electronic medical record that we have in our system. Well, oftentimes it's not possible to just come to the phone and call. I'm always busy with patients. Sometimes they could be complicated patients I'm trying to sort out. I may be talking to the family. For example, other times, there could be a patient in labor that I'm dealing with. So all these things take precedence. And so it's just not possible to call back. And so, we'll just have to take a message and try to get back to them later. Well, it's important to me that when patients come to see me in the office that I give them uninterrupted time because, it's important for me to be there privately with them to sort out their medical problems, listen to what they have to say. But that said, when a colleague of mine or a nurse calls me about a medical problem about another patient that they want to discuss with me, I do take the time out to come out and talk to them. So I do excuse myself out, partly because it's important and I don't want to miss it, and oftentimes just playing the telephone tag with these colleagues becomes very frustrating. I don't want to miss talking to them if I need to. Of course, if it's an issue that really can be held off until the end of the day, then I will make a point of returning their call. And many of my colleagues and other health professionals realize this. They're very courteous, and they will defer, or they will leave a message for me to call them back. Well, one of the key features in family medicine that's unique to this discipline, that's not found in any other discipline in medicine, is our ability to build long-term relationships with our patients and their families. And good family doctors, and I like to include myself as being one of them, really involve themselves in their patients' emotions, and they become an important part of a patient's network of relationships. When that happens, it's much easier for the family doctor to really figure out why a patient's coming. When they come in with certain symptoms, and through that, be able to help our patients much more effectively. But what I get most out of being a family doctor are the multiple little moments where I can make just a little bit of difference in my patients' lives, whether that's treating their child's ear infection or providing some counseling for them during a phase of depression or treating their hypertension. It all goes back to this strong relationship that I have with my patients, this long-term relationship that really matters when it comes to understanding their illness and helping them. I've been in practice long enough to deliver babies, and now they're growing up, or they've grown up, and now I'm delivering their babies. And the joy that comes from being able to see them bring back their babies is what puts a smile on my face. So even though I have stacks of paperwork to do at the end of the day, when I think of that part of my practice, then it puts a smile on my face and I can come back the next morning to work.